It's a link.
When I saw you and that girl.
Bria was joking around earlier.
You joking?
I know. But you know, we have a hard time getting the Gov and Lieutenant Gov on the show. I was thinking, what if we do a GoFundMe, little $500 donation to the fundraiser, and then we get, because I don't know, what do you think? Jay got $7. I got 5.
I got $7.38.
That's 12. He's got $7.30. Joe, sir, what you got? $5. Okay. Slowly, we're gonna make our goal. Yeah, guys, we were talking about this earlier. There's a big fundraiser tomorrow at the Hyatt here for the re-election effort of the governor and lieutenant governor. We kind of just been joking around with people coming on the show, like, "Are you going?" I think Jerry really took the cake this morning when he said, "Oh, only if Uncle Carl is treating." That's $1,000 dinner date right there. 8:38. I don't know. Did you get any tickets to that, Lillian?
No, we have a board of trustee meeting tomorrow night, so I'm not going to be able to.
Hiya, Day.
Welcome back.
Lillian Posadas here. Welcome back, Lillian. We missed you.
Yeah.
But I miss you all. 5 weeks. I was gone for 5 weeks.
Wow.
Well deserved.
Yeah.
Well deserved.
It was for medical reasons, so
Right.
I had to do it.
Right.
Yeah.
Still, at least you got, some rest, right?
I did. That's what I was just telling Jason. I got caught up with my sleep. So
That's really good. Are the numbers right? I mean, do you still do the census and stuff, Lillian? What's going on? Could we just kind of start there? Like, what's going on with the census at GMH?
yeah, we are really on a steady state of condition here. Our census has been low, which is, we're very thankful, and we feel that it's promising that the COVID is getting to a point where it's under control and we're managing it as a community. So the census has been at a steady state of 3 since last week and over the weekend. This morning, however, we did pick up on 1 individual who came in, so we are now at 4. 2 of those individuals are in the intensive care level of care and are on ventilator support, and the other 2 individuals are on a telemetry level of care. So they're all pretty stable.
What about non-COVID?
Non-COVID census has picked up. The ICU, though, it's steady, it's low, but the cardiac monitoring and the medical surgical non-COVID census has picked up. We are over 100 in that area of our patient census.
What are some of the things that are going to be discussed at the Board of Trustees meeting tomorrow?
Well, for one thing, because the budget is due to the legislature at the end of March, so that's one of them. The ongoing project of the electronic health record system, that's coming along. There's quite a bit of discussion. The alternate care site that has been approved by FEMA, we're just now waiting for the funds that's been obligated. The situation with the travel nurse, we're going to discuss that tomorrow. What our plans are going to be, and bringing back, we've already brought some of the normalcy in terms of elective surgeries. We're doing some elective surgeries already, because we need to get going back with that. So several other issues. I just don't have the agenda with me in front of me, but
if you could, what's the situation with the travel nurse?
Well, right now, because our census has come down, we have decreased in our requests for travel nurses, but we still are utilizing them, in the ICU area, in the telemetry, and in the emergency room.
Have we paid out for all of the travel nurses, the contracts?
No, we're still pending some invoices that we need to pay, and we're waiting for the FEMA public assistant reimbursement that we requested. And so I'm informed that that has been approved. It's just now waiting for the funds to then be transmitted.
Are we? But we're not behind or anything like that in paying.
We are.
Oh, we are.
We are behind.
How
Yes,
far behind are we in paying out this contract?
I don't know the number of invoices that we are far behind, but we are behind in terms of, I believe, 3 million
Oh.
that we owe the companies. So, yes.
Are they threatening to say we just can't send any more travel nurses, or?
No, they're not threatening us because they understand our situation. In fact, we have a 9 o'clock conference call with them to discuss it further. You know, and the other option that we're looking at is, you know, since we're kind of behind now the crisis situation, and so perhaps we can renegotiate the rate that you know, they are charging us. So we're hoping that we can decrease the costs.
So, I'm sorry, did I miss? Do we still have travel nurses here?
Yes,
have
we
travel
still
nurses.
Okay.
We just are behind in
And paying them, right?
the
So does that
contract.
jeopardize any future effort to secure them? I know
No,
they're not threatening, right? But are they going to be like, hey, you got to, like, you know, pay your balance before we send anyone else?
Right. Sure. I mean, you know, and it is right. It's rightfully so. We have to pay for the services that they provide. So, yes, we are, you know, we are diligently going after the funds to make sure we pay them.
And is the reason why we're behind is because of we're waiting for FEMA, or?
Well, yes, we're waiting for the funding. In our initial discussion with FEMA, you know, they did assure us that they will expedite the documents and the paperwork and the requests and the reimbursement. So, you know, but, you know, they're tied up too with all that's going on at the national level.
Right.
So.
But has FEMA given an indication on when they would be releasing these funds or providing these funds?
There's no specific date, specific time, but the communication is open, and they are letting us know that, you know, it's forthcoming. So,
Okay.
yeah.
The alternate care site. This is the SNF, the skilled nursing facility. Yeah. What's the update on that?
Well, we are working with the contractor to begin the process of isolating one of the wings. And we're also looking to bring back the skilled nursing unit residents who are temporarily housed at the Catholic Social Service Facility. You know, we're looking to see maybe in about mid-March, depending on this PCOR 3, what happens if there's going to be a surge. You know, we want to still keep it readily available, that if the numbers pick up, we have that facility ready to open up. But we are also seriously thinking of, you know, if how the outcome is of this PCOR 3, that then we can move those residents back to a safer facility. Not that it's not safe, it's just temporary. But if in the event, again, we have a typhoon, we just really need to get those patients in a safe.
Lillian, what about the blue med tents? They've been taken down, right? And then are they readily available just in case?
Yes, it still is readily available, and that's why we're monitoring with this PCOR 3, that if there is a surge, we have the blue med tent also. So we're monitoring the situation with the PCOR 3.
Well,
But can we talk?
Yeah,
Go ahead.
No, I know you wanted to talk about this public health emergency bill.
Yeah, I'm just, you know, disappointed and disheartened that the legislature feel that they need to exercise their authority to, you know, automatically terminate a public health, the declaration of a state of emergency, when really there is already in existence in the law that they can terminate. And I don't think there's a need for this bill to be put up front. And you know, perhaps maybe the businesses are pressuring the senators to do something. But, you know, if they really look at the bigger picture here, that if it had gone into termination of the state of emergency, we would have seen more hospitalizations, we would have seen more individuals sick with the COVID, needing hospitalization, and probably we would have seen more deaths. We would have had more deaths in our community. So I rather that the legislature take a more collaborative, cooperative, working relationship with the governor. You know, that recognizing that the governor had to declare the state of emergency and had to sustain it. And she was meeting with medical professionals to give her guidance, using science and data to, you know, guide her decision. She wasn't acting in an arbitrary fashion or in a capricious fashion as what they stated in this bill. Again, it just doesn't help the relationship. We needed to take action. We needed to make decisive, action, and we needed to come together to quickly make decisions as far as how we are going to respond to this COVID. And it's not just this COVID. If we are in a state of emergency, public health emergency, it could be something else. But again, I just was, hoping that the leadership of the legislature would take a more collaborative and cooperative approach, and not that calling the governor that the governor was acting in a capricious and arbitrary fashion when it wasn't. That's not the case. She had a medical advisory group that was guiding her, and she was using data and science to make decisions in the best interest for the island, for Guam. Not just for a few groups of people, but for the whole island of Guam.
Lillian, what would you say to those people who are watching this and listening to this and saying, oh, well, you're in the governor's cabinet, of course you're going to say that?
Not necessarily because of that. From my perspective as a nurse, and from my perspective as far as handling the hospital situation and what we were going through in the hospital, the staff, the nurses were exhausted, the doctors, we were limited with resources. If the businesses or everything was kept, if we didn't have this, extended declaration of emergency and open up everything, we would have had more sicker individuals. And it doesn't matter whether I'm a cabinet member. I'm coming from a perspective from the standpoint of being a registered nurse and here in the hospital, seeing what has happened and seeing what could have happened if the declaration of the state of emergency was then ended. It's just just not the prudent thing to do.
Right. Yeah, but Lillian, you talk about, you wish these lawmakers would be more collaborative, and work together. But at the same time, then how would you respond to the legislature who would say the same thing of the governor? That she needed to be more collaborative. She needed to be more transparent. Because, at the beginning of the pandemic, we heard from the mayors and they're like, we don't know what's going on. She hasn't, talked to us. She hasn't, we're the frontliners in the community. The legislature, they passed bills, became laws for her to be more transparent. So how would you respond to that?
Well, she was transparent and there was that communication. But here again, for me, rather than sitting back and saying, well, the governor isn't telling me anything, I would take that approach as a mayor. Okay, governor, what is it that we need to do as a community? Own up to it and take the initiative to say, hey, we're here. We're here to work together. Don't just sit back and complain and whine that, well, the governor didn't call me. The governor didn't talk to me. Come on.
Yeah.
We're officials. Yeah. We're leaders.
Right, we're leaders, but at the same time, like the physicians advisory group, senators were banned, the public's banned from attending it. So the only people that get to attend it is the governor.
With the physician advisory group?
Yeah.
Right, you said that she gets her advice from the medical professionals, from the physicians advisory group. You talk about collaborative, and transparency. And we heard it from the oversight chair when Senator and now Speaker Theresa Lahi, she had made attempts to participate and be involved and to hear, the physicians.
I mean, she couldn't even go to the meetings. It's crazy.
So I'm just pointing that out.
Yeah, no, Lillian, I get what you're saying, that as a nurse, you feel like, the governor acted prudently, but that, you don't mean that everything was perfect. Do you agree that there were some areas of improvement? And if so, which areas are those?
Well, absolutely. We're human beings. We're not perfect. I'm not perfect. And so, yes, there are, areas that we can certainly improve. Absolutely. And this thing is new, very unprecedented, very new. A lot of us, there was so much uncertainty. And so, yes, there certainly can be. But, there was that, I think the governor was having, if not 2 times or 3 times a week, press conferences with the media. And so there was that communication that was available for information and for questions to be asked. So, again, it wasn't being transparent. We were there, I was meeting with the governor and the other agencies, and we were in communication.
I think that
Let's not do this blame game.
Oh, yeah. No, we're not blaming anybody. I'm just saying that, when you talk about press conferences, they had 3 press conferences in the last 6 months, I think. So, and I know there were some in the height of it, but Lillian, I get where you're coming from, and I get, that's your perspective, but we're just saying that we don't live in a dictatorship, and I'm not one of those like, oh, the governor's a dictator, but I'm saying like with the Physician Advisory Group, public couldn't attend the meetings.
The legislature.
We have a senator has in charge and oversight of the health committee. She couldn't even go on the meeting, and at the very least, I feel like if the governor is going to make those kind of decisions and had people been able to be a fly on the wall or watch any of these meetings or see any of the behind the scenes of what led to these decisions, then maybe they wouldn't be saying that the decisions were arbitrary and capricious. They would be saying like, oh, that's why they said it, because Dr. So-and-so. And so you see when there's this whole process that is not, maybe shrouded in secrecy is not the right way to put it, but when there's no public accessibility, then if we don't understand the math that went behind, like say, for example, allowing game rooms to open but not other establishments or whatever, then of course people are going to be like, there's no rhyme or reason. So do you think that with more transparency that would kind of throw water on some of these arguments, or even accessibility?
Well, if I could also just share our experience here in the hospital, things were happening very fast and decisions needed to be made quickly by a few of us. But then we get back, so not everybody, we couldn't get everybody all in the same room to discuss it, to hash it out, and to make decisions. We had to make decisions, and we had to make changes quickly here in the hospital. And so, it's not anything personal against anybody, it's just that things were happening fast. And so that was what was going on with this COVID. And it's, people just try not to take it personally, but hey, these are the issues, these are what we have to deal with, this is what we need to do, to decide, to take action.
Right.
So how about Bill 13?
Bill 13, what's Bill 13?
The nurse licensure compact bill.
Yeah.
It passed.
Well, from Senator Mary Torres that it got passed, so that's a good sign. It's a good thing. So we thank the legislature for supporting that.
Why did it seem like this measure was like kind of controversial?
Which one, the nurse
The
licensure?
nurse licensure, there was an argument that it would allow nurses on Guam to go out to other jurisdictions where they can make more money, but we got low nurses pay here, right? So there's also, I think, a measure to do something with the nurses pay. But was this kind of a no-brainer for you, Lillian, the nurse licensure thing? Because I know we had you on before about it.
Well, it's really going to benefit the island. For the argument that we're going to lose more nurses, we've been losing nurses. Nurses leave on their own volition, but the benefit is that we're able to then bring in more nurses at a much more expedient process. And it encourages, and as I pointed out, the military community, there are nurses there who are active duty, and there are also spouses of active duty personnel who are registered nurses, and they get deterred by the process of having to apply for a new license here in Guam to practice. But because they have license to practice in other states, who may be part of the members of this compact, then they can, begin the process of working here in the community outside of their military health facilities at a much quicker process. And so that's going to be one of the big benefits. And, again, the argument that nurses are going to leave, they've already been leaving. For many years they leave. And that's why we continue to have this nursing shortage.
Right.
Man, Lillian, we did get this. Have you seen this text that's going around about you in the quarantine?
About me in the quarantine?
It's something I don't want to because it's like some of it's like medical, but there's a text going around about you were able to skip quarantine, but you're essential, right?
Okay, no, I haven't seen that text, but you know what? Okay, fine. I requested for an exemption, because I have to come back to work at the hospital. But I went through the process of testing before I left Guam, and I completed my vaccination, the first and second dose. My husband completed his first dose. We got tested before we left the Taiwan hospital. And I came to be cleared here at the hospital by the employee health nurse. And if I needed to be tested, I said, let me go through the testing process. So, I went through the process to make sure that I am not one of those asymptomatic COVID patients, but I also have the vaccine. I was vaccinated, and so was my husband. So, people can make their judgment, but they don't have all the facts. But here are the facts. I was tested several times.
Thank you. That's why all we can do is ask,
Thank
right?
you.
So there you go. So if you didn't have all the facts, there's the rest of it right there.
Right. Yeah.
I did want to ask a follow up on something that the governor had mentioned last week when she was asked by the media about the plans for the new hospital. Is there anything else that you can tell us about the plans for the new hospital? Possibly, I guess the governor's eyeing Eagles Field.
That's one of the military property that they're going to be returning to government of Guam. That's one of them, and I understand there's another one up in southern Finnegajan, and I believe down in is it Nimitz. But from my point of view, the Eagles Field is centrally located, and so that will be my preference. We haven't been able to go back to regroup with the task force with Gita to continue the dialogue and the planning. But that is what we're, maybe once we really are very stable with the situation with the COVID, we can refocus our energies and our, time to then really start talking and planning for the new hospital.
All right. Anything else going on at GMH that you can share with us? Lots. I can imagine.
We've launched our telehealth, our telemedicine, and so that's been very helpful. And so it's always something going on at the hospital.
Yeah.
Oh, what about visiting? Someone was commenting
Yeah.
our visiting hours. Have we changed the policy?
Well, we just discussed that yesterday at the executive management, that we are looking to relax on some of the restrictions, particularly for patients who are age 75 and older. We can allow, who are non-COVID, we can allow a family member to be with their loved one who is 75 years old and older. But we're still also trying to get through some of the logistics, such as a waiver form. We're not going to require that family member to go through COVID testing, but just some of the logistics of it, the details. And we'll get that once we have it solidified today at our huddle with the directors. Then we'll communicate that out.
Are you looking possibly by the end of the week to make announcements about the visitation change, policy change?
Right. We're looking to get that by the end of this week.
Okay. Thanks, Lillian. Good to see you.
Thank
Good
you,
to see
Lillian.
you all. Glad to be home.
Right on. Take it easy.
Take care.
Yes,
Take
there
care.
you go.
Bye-bye.